Hello, my name is Brooke Ponting, and I did my signature assignment on ectopic pregnancy. For my PowerPoint, I will be going over the etiology, the demographics, anatomy, as well as there will be diagrams, the physiology, symptoms, also diagrams, diagnosis, treatment, as well as AI treatments, and then my references will be at the end. An ectopic pregnancy is when a fertilized egg implants itself outside of the uterus. So for the remaining of this presentation, I will be going over the fallopian tube implantation or a fallopian tube ectopic pregnancy, because even though this is rare, amongst the rarity, this is the most common type of ectopic pregnancy. So some risk factors that could cause this are previous problems with the fallopian tube, like being too narrow, and that could be something that you were just born with. They're damaged or blocked, maybe irregularly shaped. STIs like chlamydia, which also leads to pelvic inflammatory disease, is also another risk for ectopic pregnancies, because what happens when something like chlamydia goes undetected, it can cause pelvic inflammatory disease, which is an infection within the female reproductive system. And what it does is it causes inflammation. The body then tries to fight this off, and there's then scarring around the infection. The scarring can then block out the fertilized egg as well. Things like a previous ectopic pregnancy as well, surgery on your fallopian tubes, fertility treatments like IVF. If you have an IUD and it's not properly placed within your cervix, sperm can then travel above it, and you can also have an ectopic pregnancy. And then smoking, and if you're at a higher age, you are at a higher risk. Now, there are some AI models that are being explored to detect ectopic pregnancies sooner, using things like the support vector machines, which create algorithms from previous symptoms, previous cases, and it puts it all together to help patients. Now, ectopic pregnancies are rare. However, in North America, there is for every 1,000 pregnancy, 6.4 people are diagnosed. Normal highest age range is 35 to 44. Women older than 40 were found to have an adjusted odds ratio of 2.9 for ectopic pregnancies. Black females are at a higher risk for ectopic pregnancies. Now, some statistics that I found outside of North America, it seems to be that ectopic pregnancies were at a higher rate in the UK. For every 1,000, there was 11.1 people diagnosed. In other countries like Norway, for every 1,000, there was 14.9. And then in Australia, being the highest, for every 1,000, there was 16.2 people diagnosed. So for this section, I will be going over the anatomy. As you can see on the left-hand side, There is the female reproductive system, and the oviduct, which is also known as fallopian tubes. Now, there are four parts of a fallopian tube: the infundibulum, the ampulla, the isthmus, and the intramural portion. I found that fallopian tubes are lined with ciliated columnar epithelium cells, as well as they have a wall of smooth muscle and intermuscular lining and an outer layer of loose supporting tissue known as serosa. So, for the most part, when there's an ectopic pregnancy, it's in the ampulla part of the fallopian tube. So in the infundibulum, it's at the bottom. You can see on the figure where it's flared or fringed. It's almost like a funnel shape too, in a sense. And then the ampullum is the expanded region, which is medial to the infundibulum, and fertilization of a secondary oocyte typically occurs here. However, like I said before, this is also the main area for ectopic pregnancies. And the isthmus has fewer longitudinal mucus folds, and this extends medially from the ampulla toward the lateral wall of the uterus. And it forms about 1/3 of the length of the uterine tube as well. And the last part of the fallopian tube is the intramural portion. This extends through the uterine wall and opens into the uterine lumen. And it also extends medially from the isthmus and is continuous with the wall of the uterus as well. For this slide, we'll be going over the physiology and symptoms as well. So again, in the previous slide, I went over the 4 different parts of the fallopian tube. But you can see in the figure on the left, there is a diagram where you can see what looks like a fertilized egg. And it's kind of going over the other type of ectopic pregnancies. But again, in the ampullary tube, that is the most common ectopic pregnancy. Some early symptoms for women could be missed periods, because again, while she is pregnant, it just has not fully reached her uterus. Breast tenderness, nausea, light vaginal bleeding, and shoulder pain. The shoulder pain is caused from the bleeding on the inside. Some emergency symptoms. This is when it's like pretty much too late and medication is not going to help. You need surgery or unfortunately you're going to die. So fallopian tube rupture, when this happens, it causes internal bleeding. Severe bruising on the abdomen to indicate heavy bleeding inside. If she's fainting, extreme lightheadedness, and she goes into shock. Unfortunately, the estimated mortality rate for ectopic pregnancy is for every thousand people diagnosed, 4 of them will unfortunately pass away. What doctors want to do when they are looking to diagnose an ectopic pregnancy, they really want to see elevated HCG levels. And this could be done through urine and through blood, as well as they're most likely going to do an ultrasound exam too as well. This will be able to see where the egg has implanted. Methotrexate is a medication to help stop the fertilization from continually to grow, causing it unfortunately to lose the fertilized egg. When there is an ectopic pregnancy, there is nothing that they can do to save the fertilized egg. Unfortunately, you must go through with medication if you catch it early enough, or if your symptoms are so severe and you have to have surgery, you could have your tubes removed or just the egg. But again, there's no way to save, unfortunately, the fertilized egg. Now, there are studies that are happening with AI, with support vector machines. These are providing a higher accuracy for specific treatments for patients. So again, by gathering all information on the patient's background, the patient's just overall history, family history, and what it does is it creates an algorithm to have an accuracy of the possible outcomes of this patient, to prevent, or I'm sorry, to once diagnosed, figure out what treatment would be best before it's too late. And this concludes my presentation. Thank you so much for listening.